Service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency. We are servicing Palm Beach County, Broward, and Miami-Dade. And you can call us directly, 954-717-7027. I am your host, Louise Gomez. Welcome to the show. And a real quick announcement. We're excited to announce right here at All County, we are actually looking to hire RNs, LPNs, physical therapists, occupational therapists. Please call our HR director at 954-717-7027, and that is Andrea Rodriguez. And we also are announcing tomorrow on the 8th, we do have our job fair. So you can see us at Plantation Central Park, 9151 Northwest 2nd Street, right there in Plantation. And make sure you pass the word. Let anybody that you know that's looking for a job, let them know to give us a call. And today I am super excited to announce we have Dr. Kettia Alusma-Hibbert. And Dr. Kettia is at the Espinoza Neuroscience Institute, and that is right here in Boca. The address is 875 Meadows Street, Suite 323, Boca Raton, Florida, 33486. And they can be reached directly at 561-788-7545. Thank you so much, Dr. Can I call you Dr. Kettia?
Yes,
you have a long double last name. Thank you so much for coming on to the show, Dr. Kettia. We appreciate it.
Thank you for having me. I appreciate it.
Yeah, so you are at the Espinoza Neuroscience Institute. How long have you been with them?
So I've been working alongside with Dr. Espinoza since March 2018.
Okay.
I'm currently one of a couple of nurse practitioners that are part of the practice. When I started working with him, we were part of the Boca Raton Regional Hospital staff. And then he had branched off to private practice. I followed him. So we've been together 6 years and growing. It's an amazing time that we're having, helping patients with their neurological needs.
Yeah, and it's definitely something that's necessary, especially nowadays. People are wanting answers.
Yes.
And they want to get to the root of what's going on.
Yes.
So before we get into all that, could you just give us a little history of your background and where did you go to school? If you can share with our audience a little bit more about yourself and your experience.
Okay, so I am a Florida native, which I know is kind of like a unicorn.
Yes.
I was born in Naples, Florida. My family still resides in Naples, and I grew up outside of Naples in a small town called Immokalee. It's a small agriculture town. Went to elementary through high school there, and then I came to Florida Atlantic University for my college experience. I didn't finish at FAU, but I transitioned after my sophomore year to Nova Southeastern University, where I completed their nursing degree, their Bachelor's of Science in Nursing. After that, I went to work at Boca Raton Regional Hospital.
I see.
So keep coming back to Boca.
Yes, yes.
And I worked in the neurotele unit. So I worked there for approximately 3 years, started as a baby nurse, I like to say.
Okay.
And then became like relief charge nurse. From there, I went on to work in the neuro ICU at University of Miami Hospital. I did that for 3 years as well, and during my time while I was there, towards the end of my stay at UM, I was in school enrolled at Palm Beach Atlantic University for their doctoral nurse practitioner program. So
Nice.
I am a board certified family nurse practitioner, but my degree is a little unique because while I was in school, I obtained the terminal degree, the clinical degree in the nurse practitioner profession. So I am a doctorate in nurse practitioner, which sometimes can be confusing
Yeah.
to patients, but how I like to say the analogy is think of a PhD for education. Because the doctor title sometimes gets associated with medical doctor only, but there's physicians and other professions that hold doctorate title. So that's a little bit about me.
Nice. Very extensive background. Thank you for sharing. So can you give us a little bit more about like your day-to-day? What exactly are you doing in the Institute? Is it research? Is it evaluations? Can you give us more info as what it comprises of and what your duties are?
So within the Institute, our practice, we work as a comprehensive neurology office. We offer patients new patient visits, consultations, follow-up visits. We also perform nerve conduction studies, EMGs in-house. We perform EEGs, and the difference between those two diagnostic workups, EMG is more specific for nerves, muscles. When we want to work up somebody, let's say you have neck pain, lower back pain, you have maybe a twitching or a neuropathy. If there's concerns of ALS, that's where the nerve conduction study comes in. For the EEG, it's a brainwave test, and when we're concerned for seizures or episodes of altered consciousness, we perform those studies in-house. Additionally, when we want to focus on patients for memory, we offer neuropsychometric evaluation, where we have neuropsychologists that come in and do a comprehensive overview of looking into the patient's full history to kind of dive in to figure out, is it an organic cognitive impairment? Possibly it could be depression. Possibly it could be that you had a learning disability that as you age, it's harder for you to process things. So we do a lot of interesting things within the Institute. Additionally, we are a part of research. We're currently enrolled in several studies right now. We're enrolled in the Alzheimer's studies to show the efficacy of one of the first FDA-approved medications to target amyloid beta protein. We're in a clinical research study for spasticity for patients who have upper limb spasticity, and comparing Botox, which everyone's so familiar with, versus another product to see the efficacious, if Botox lasts longer versus the other one, which is exciting to be able to be a part of that. We have a couple of other ones that are launching, and it's exciting to be a part of this as neurology continues to evolve.
Yeah.
Because I like to say that they've studied the heart in and out
Extensively.
and the brain is always kind of like, how can we better understand it? So very exciting right now in the Alzheimer's space. With Parkinson's, there's a lot of research going on. And in our office, Dr. Espinoza always likes to say that we're early adapters. We want to ensure that we are giving the patients the best options available, and the most appropriate, obviously, for the patients, but best options available to ensure that we give them the best outcomes. So very exciting.
What is the age range of the people that would be going to the Institute?
So we see adults primarily.
Okay.
However, we will see pediatrics in terms of epilepsy. So Dr. Espinoza, he's a board certified epileptologist. So he did his fellowship in epilepsy at Harvard. So we do have some patients that will come in if they've seen, or maybe it could be a family friend, and they had their first episode, the child is having some staring spells, or they had their first seizure. He will see those patients as well. So
Touching back on something you just said, you were talking about depression. And so I find it interesting how, memory can be, or loss of memory maybe can be triggered by, right away. Maybe some people think like, oh my God, I have this loss of memory, thinking it could be Alzheimer's or dementia. But it seems that so many different factors come into play.
yes.
You mentioned depression. Can you talk about any other factors that would come into play that would affect memory that, maybe is not Alzheimer's or is not? what we think or what we're worried about.
Well, typically if a person comes into the office concerned about memory,
Yes.
we would do a quick spot test in the office. It's called a mini mental state exam. There's also a MOCA test that we could do, but we typically do the mini mental in the interest of time. We would gather history of present illness. So when did your symptoms start? Are you able to identify anything? Is there any triggers that you notice that helps your symptoms? Is there any family members that have concerns?
Right.
Because oftentimes you can kind of decipher when a person comes by themselves versus when they come with a loved one, and the loved one is giving examples, then you kind of know where the conversation's going.
I see.
Then what we would do after the first evaluation is we would order MRI of the brain as well as labs. So depression sometimes can be mimicking Alzheimer's, so what we call a pseudo dementia, or sometimes it could be that your labs are off. Maybe your TSH is off, your thyroid, maybe your vitamin B12,
Right.
folate, these things that are reversible, that we just need to get your vitamins in the proper
Right.
order and you'll be fine to go. So typically blood work, MRI brain, and then we also do the neuropsychometric evaluation, which is a comprehensive test, and that looks at so many different domains, and we go from there.
So wow, I find that so interesting that there's so many different causes and there's so many different things, and you're able to really decipher and then work on that with that person, whether it's their vitamin or vitamin levels or whatever. So that's really interesting. We're going to have a quick commercial break, and then we're going to come back and continue this conversation. I'm really enjoying it. So
Thank you. Thank you for having me.
stay tuned, everybody. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor. Today we have Dr. Kettia Alusma-Hibbert, who is a DNP. Like to make that clear. And she is right here at the First Choice Neurology in Boca. And that's actually right here, 875 Meadows Road, Suite 323. And the phone number is 561-788-7525. So that's right across from the Boca Regional Hospital.
Right across from the ER.
From the ER, and they're expanding so much there.
Yes.
Last I was there, they were just doing so much construction.
Yep.
There's so much growth. You know, we're lucky to be here because I feel like some of the finest doctors in the world are right here in Boca.
Yes.
So I feel blessed to say that I live here, and there's so many wonderful doctors
Yes.
here, and I'm sure Dr. Espinoza, you said he went to Harvard and he has all these credentials.
Yes.
And you do research, you see patients. There's so much that you do at the Institute. is there any anything you could talk about, like the future of things coming down the pike that we should know about? Any new future developments or medications or whatever's new and exciting in neurology?
Well, there's always a lot of interesting things. So my background is kind of unique. As a nurse in the nursing profession, we typically don't have a residency. So I've always worked in neurology. So I've created my own little residency in a sense, since I went from neurotele to neuro-ICU and now neurology outpatient.
What is neurotele? You've said that before.
So neurotele is typically patients that come into the hospital and they're acutely ill with, let's say, confusion, delirium, strokes, first time they had a seizure.
Got it.
Or we can be sometimes overflow for like cardiac patients, because we do telemetry reading where the patient's connected to the heart monitor.
Yes.
So, or a brain tumor, you know, there's so many different things.
Sure.
But neurotele is typically the floor, is what we would say, and then neuro-ICU is a little bit more intense. So when I was working in the neuro-ICU, I was dealing with more patients following brain surgery or back surgery, neck surgery, so very acutely ill where they need the extra eyes on them and that extra care. So with neurology, being that my career has been over 13 years, I've seen so much have changed. Interesting enough, within neurology, there's so much advancements that it gives opportunity and hope for the future.
I love that.
For migraines, when I first started working in 2018 as a nurse practitioner, in my role, they rolled out a new drug class that was able to be beneficial to patients. I've had patients that come in with migraines for years.
That's awful.
Years, been in clinical trials, this and that, and this new drug class comes out and changes their lives, which is amazing. And then brings us to the present day now. The FDA has approved new therapies, and there's more to come in terms of Alzheimer's dementia. Currently, the life expectancy in the United States of America is 74.5 years. And historically, people would die from a heart attack or other causes, so we were not as aggressive in Alzheimer's treatments. It's been a lot of years put behind the new therapies that are coming out. There's controversy, yes, but it gives us hope for the future, because if you've survived your heart attack, you have 6 stents, and now you're having this memory issue, there's hope that we can possibly target it before it gets severe. There's no magic 8 ball, but with the new therapies, the goal is to wash away abnormal proteins that they believe to be the culprit of Alzheimer's dementia.
That's what I wanted to talk about, because I heard you mention something about that medication that helps clear the amyloid plaque.
Yes.
So I understand, and please correct me, I'm not sure. So buildup of amyloid plaque in the brain is what helps people with, actually activates the Alzheimer's, or how does that work?
So it's part of what they have seen throughout research, and this is many years. This is like over 30 plus years of research.
Right.
They realized a common denominator is alpha beta protein, and there's different subsets of it, because they do a ratio, the 42 versus the 40, and to see how much that your body has in you. We can assess for that through PET Amyvid, which as of January, Medicare will be covering.
Oh my God, that's
so
amazing.
Right now it's $5,000, but in the future,
it's going to be covered.
It's going to be covered. So we can do a test to kind of evaluate, do you have the abnormal proteins that we believe to be the culprit that leads the cascade of Alzheimer's dementia.
Wow.
The other way is a little bit invasive. It's through a lumbar puncture, so a spinal tap, where they would remove some of the CSF, and then they can evaluate based off the CSF if they see the protein. But what the studies have shown is that when patients have a high accumulation of this amyloid beta protein, that it starts causing neuronal death. So the brain tissue starts dying out. And typically, we would see on the MRI
Right.
that there is thinning in the memory centers. And when there's thinning in the memory centers, we know that correlates obviously with the objective data if the patient has a low mini mental state exam,
Right.
as well as families giving examples of, you know, grandma got lost, or,
Sure.
you know, they used to pay their bills on time and
Yeah.
now, you know, the finances have become an issue. So we take all that information, we can kind of right now say it's Alzheimer's dementia, but in
Yeah.
the future we'll be able to kind of target the culprit and prevent you from progressing. That's the goal.
Wow. So Medicare is going to actually pay for this test?
The
you're saying?
PET image.
The
They
PET.
came out with
amazing.
a decision a few weeks ago, so I have a lot of
needed.
patients. Yeah,
You're going to get busy.
we're already
you
busy.
better prepare and gear up because
We're ready.
That's good because a lot of people are going to get the answers they need.
Yep.
And you're going to be busy.
Yes. Yes.
So is there any type of, like, do you suggest, like, is there any types of food we should be avoiding or eating, or you don't discuss that?
Healthy
or?
lifestyle.
Okay, yeah, let's get into that,
Yeah,
please.
exercise at least 30 minutes.
Okay.
5 times a week. You know, just walking.
Yes.
And that also too, just walking is peaceful to the brain.
Oh,
Less
yes.
stress.
Yes.
Better for you. Healthy diet, try to refrain from high saturated, high fat food,
Right.
because there's other forms of Alzheimer's, or I should say other forms of dementia.
Okay.
Alzheimer's is the most common cause, but there's a vascular dementia, and that's typically when patients have a lot of strokes. And that strokes is like another major key you
I
want to prevent
see.
to have a healthy brain. So in the brain, it's all about real estate. Location, location, location. If you're having a lot of strokes within
Yeah.
your memory centers, you're going to have a lot of difficulty. And not only that, you'll have heart disease and other issues too. So
Right.
we like to say healthy heart, healthy brain, healthy lifestyle. So
Yeah, so the whole lifestyle comes into play
yes.
when you're doing that. And for years, you know, the main focus has been on heart studies and studying the heart and whatnot. So, you know, now I feel like it's really more prevalent that people are wanting this research done and
Oh, yes.
wanting answers. Yeah.
Correct, yes.
Yeah.
It's a lot of interesting different ways that they're looking at research, because the first part is we're getting these amyloid beta targeted therapies out. The next part is going to be, so if my mother has Alzheimer's,
Right.
what does that mean for me?
Right.
When does it start working in the background? So there's also research going on for a child of somebody who has Alzheimer's, and how can we target early on, because we want to keep you as optimal as possible.
Right. So it is genetic. Is
That's where the research, all the data from the
Okay.
research will come from, because sometimes it will be the first person.
right.
And sometimes it could be a lineage where mom, dad, aunts, uncles. So,
Right.
yeah.
Right. So, Dr. Kettia, we have 2 minutes left. So, what would you like to share with the audience in the next couple of minutes? What do you think you know, if there's somebody listening, maybe they have a loved one or they know somebody who should go see you, or what advice would you tell somebody right now who's tuning in to us?
Well, I would say if there's any concerns within neurology at all, I would say it's important just to get evaluated. Sometimes when patients come in and they're so anxious and they're thinking, oh my God, I'm going to get a diagnosis, I like to put them at ease. I tell them that this office is a safe space.
Nice.
You're coming here for answers, and we're going to work this together. Because it's not you by yourself. I have to treat you as though you are like a loved one to me, because I
like
would
that.
want the same for myself.
Yeah.
In our practice, we do have 2 office sites. I know you've highlighted the 875 Meadows. We also have 801 Meadows Road,
Okay.
which is where I'm primarily stationed. Dr. Espinoza is in the 875, and that allows us to capture more patients,
like that.
because we have the option if there's an emergency, like today, for instance. I had some patient came in. We typically see her for neck pain. She was having acute vertigo. She was able to come see me, same day appointment. I
Nice.
was able to give her the Epley maneuver, help her,
Nice.
and then she can go home feeling that she's not waiting. Because as we, as time continues on, we will need more and more neurology healthcare providers. So I'm
Agreed.
excited to be, part of the forefront and getting more nurse practitioners, hopefully inspire some future neurologists to come on
Yes.
board, because there's a need.
Oh, yeah.
There's a need. And with all the new therapies coming out that can help with myasthenia gravis, Parkinson's, all these different illnesses, we are so excited to be helping.
Thank you so much. We
Yes.
appreciate you and all that you do. Please make sure you call our office, 561-788-7525. Thank you so much. It was a pleasure.
Thank you.
Take care.
All right.